Hello, everyone, and welcome to a special program here on WVUA 23. I'm Mike Royer. We hope you're having a good day today, and we appreciate you joining us to talk about something that affects every single one of us, and that is health care, now and going forward in the future. Our special guest in the studio today is Bryan Kindred. He is the President and Chief Executive Officer of the DCH Healthcare Authority. Mr. Kindred, thanks for joining us today.
Thank you, Mike.
We got you to come up and talk to us. We don't get to talk to the CEO very often, but you're looking at a retirement date later on this summer. But you've had a long career, and most of it spent at DCH. Was it 85 when you first started working there? How many different jobs have you had, and what have those jobs been? I think there's been at least 4.
I had 3. I started as an assistant administrator when I first started, and then it converted to the administrator of the regional medical center, then the chief operating officer for a short period of time, and then for the last 26-7 years been the CEO.
So if you could go back to that younger man when he first started out in healthcare and gave him some advice. Now, you're going to do this for 30, 35 years, and you're going to climb the ranks and have authority over folks here and how this operation goes. If you could go back and talk to that younger man, what advice would you give him today?
Listen more, talk less.
I tell people, in a negotiation, in a talk, the person that talks the least usually does better overall. I guess that's good advice for any of us. Listen to folks around you. How many people work under you? You've got DCH here that we're familiar with, over in Northport as well. How many employees
and
are
Fayette, about 4,500 employees in the system.
Man, that's a lot, and a lot of responsibility. You have sleepless nights, some nights worrying about them all.
I used to until I got a CPAP machine.
That helped. Your doctor recommended that.
Highly recommended.
Okay, very good. Well, I'm glad that's working for you. What has prompted your retirement? I kind of tried to retire from television. 40 years was enough for me. Is that where you are now? You just want to enjoy other things?
It's the time of life. I mean, I'll be 64 later in the summer. I have 2 granddaughters that live here in Tuscaloosa. My daughter and her husband live in Birmingham, so the time was just right for me.
You have 1 child? Just
2.
2. Both daughters?
Son here in Tuscaloosa.
Oh, that's right.
And his wife and the 2 granddaughters, and my daughter and her husband live in Birmingham.
Folks that are baseball fans of the Crimson Tide, remember your son played baseball here, had a good run with the Tide. And now he's in banking.
That's right.
Very good. So you're going to spend time with grandbabies.
That's right.
And then go to either sporting events or maybe dance or something like that. Let's talk a little bit about healthcare today. Man, it's such a challenge to get healthcare to everyone. And as I mentioned to you before we began, wherever you are politically, I don't know anyone that doesn't want everyone to be fed and everyone to get proper health care. It becomes political at times, but really it's just a thing of the heart and of passion, isn't it? That we need to reach out to everyone.
It is. Health care is a calling. To do what we do, it takes special people to do it. And so we're covering, 250, 300,000 people in this catchment area. And so we're responsible for their health care.
The challenge here in West Alabama, there have been some other smaller facilities that have closed, not able to serve people as much anymore. That puts more of a weight on your facilities and your staff.
It does.
Overwhelming at times?
It has been overwhelming at times. Again, great people figure out a way to meet the challenge.
But great people can only do so much.
That's right.
And I know you, like every hospital or medical facility in the country, you're always looking for staff. You could hire quite a few nurses today if they popped up at your door.
Sure could.
Is that the biggest challenge from your leadership position of staffing?
Staffing is a big issue for us, no question about it.
Can anything be done about it other than recruitment, good pay, better pay?
Recruit, better pay, working with the local junior colleges and with the universities right across our street to try to find more of them. Build more.
Build more facilities.
Facilities and train more.
Shelton trains nurses.
Yes.
University of Alabama does.
Yes.
A lot of good, all around there's
West
nursing
Alabama,
programs.
they're all over the place, and we work with all of them.
And they're turning out a lot every year. I don't know when there'll ever be a glut of too many nurses, but we're nowhere near that now.
We haven't seen that in a while.
Never in your career?
Rarely in my career.
Yeah. If you wanted to be a nurse, you could find a job somewhere. DCH is unique in that it is it a nonprofit?
Public, not-for-profit.
Not-for-profit. And that's not a problem most years, right? The
right.
chances of you making a profit isn't designed to happen that way, but you just serve a lot of people who can't pay. Tell me how that works. If I show up at your emergency room, insurance card, no insurance card, no money, your doctors are going to take care of
We're
me.
going to take care of them exactly the same way, whether you can pay for it or not.
Is that required by law?
Well, we're certainly required to do an exam and make sure they're not in peril before we move on. But yes, we can take care of everybody.
And it is part of the challenge. People come there because it's the only place they have to go, really.
Many of them have no other place to go because they have no coverage. So they either go to their local facility or sometimes they come to us.
There are healthcare clinics and things like that. But if you go into a regular doctor's office, first form they have you fill out is your insurance form, and most of them just can't do business
That's
for free, right?
That's right.
But your doctors have to, you have to.
do.
So do you just kind of show a loss every year financially?
We do. I'll just tell you what it costs us to provide care to those who can't pay is about $40 million annually.
That's a lot of money.
That's a lot of money.
Yeah. And you still have to pay your doctors. You can't get doctors to work for nothing. In fact, if you don't take care of your physicians, or if the program doesn't, they'll have to figure out another practice, another thing to do to make a living.
Right.
We talk about nurse shortages. What about other staff, physicians, surgeons, other staff members throughout the hospital? Does that
Physicians, pharmacists, physical therapists, environmental services, some of the entry level are hard to find too.
Is that right?
Yeah.
So even you don't have all the physicians right now you could use. You could always use more.
We're looking for several.
And do you recruit?
Yes, we do.
You don't have to go far. I know a pretty good medical school not far from you.
Not very far.
And so you recruit to them and other places, other states. Just give me a little insight into the guidance of how you try to keep your staff.
We have a physician recruiter. I'll just talk about physicians. So we have one person that does that, and we're looking for whether it's an obstetrician, neurosurgeon, family practice, whatever it is. And so we're constantly out there looking for those individuals to see if there's a match. Do they want to move to Tuscaloosa? Is there something that you would like to do here? Or your family have some connection? And so that's usually how it starts. And then we go from there and see if we can hook them.
I want to follow up with a few more questions about staffing and how you
Sure.
hook them and get them and then keep them, because getting them's one thing, keeping them's another.
That's another.
We'll take a break and talk more about that in a moment. I want to talk about leadership at your hospital. You're retiring. Your CEO is retiring in the summer as well. Is that right, Mr.?
No,
Your
his COO is
COO is
Yeah.
retiring along with you, and about the same time, we'll talk about that and a few other things about DCH. It's our biggest and best hospital in our area. It serves a lot of you. We'll talk more with the outgoing CEO when we return in just a moment. Stay with us. Bryan Kindred is the President and Chief Executive Officer of DCH Healthcare Authority, and we're enjoying a conversation with him. We get to speak with Andy North, your Vice President of Marketing and Public Relations there at the hospital. He does such a good job for you. I know you know that. But we don't get to talk to folks like you very often, so thank you so much for being generous with your time today. You were talking about recruitment a moment ago and how you recruit doctors. You use the term hook them with a smile on your face, and then try to keep them. Is it hard to keep them, or once they get with your system and kind of see what DCH is all about, they tend to stay around a while? How does that work?
Usually once they have made a commitment to come to our community or move their family here, they stay. For the most part. Not always, but they do.
Yeah, life changes, things change, but getting them to Tuscaloosa, once they see what the area has to offer, I'm sure is important to them as well.
It's not a tough sell.
Yeah.
Tuscaloosa sells itself.
I believe that. What is it about our area that is attractive to people?
Well, it's close enough to a bigger city, if that's what they want. Sometimes they're just looking for a smaller community, and this fits the bill.
They might do all their training in New York or Boston or Chicago or Birmingham and go, boy, I'd love a good school system, a low crime rate, and so that would be attractive to them.
That's right.
Are you from Tuscaloosa?
I'm not from Tuscaloosa.
Tell me where you're from and where you were raised.
I was raised in Phoenix City, Alabama.
Yeah.
And
Been
so
there.
my wife and I moved here 37 years ago.
What do you know? You've been married how many years?
42 in June.
Good for you. Just next month. You might as well go for 43 now.
I might. I am. I am.
Yeah. If she'll stay, that's the
yeah,
question.
she will.
Yeah. Okay. You're pretty sure.
Ball's in her court.
It's always been in her court.
Yeah,
but
correct,
you know that.
correct.
You know that. Tell us about general care at DCH. I know we've mentioned the emergency room, and we'll talk more about that maybe in a few minutes. But generally, looking back, what would you like to see? New leadership, new physicians, people going forward, 5 years, 10 years, 15 down the road. What are going to be some of the things you'd like to see DCH focus on to be as good as it is or even better down the road?
We need to constantly look at the delivery of care. I mean, just how we interact with our patients. We want to have better communication. We want to take care of their needs as best we can. And that comes, only happens by having the best staff and people that really care about their patients. That includes the physicians too.
I've only had one experience in your hospital in the emergency room. A friend of mine who worked here at the time had a heart attack. And I walked up there and the security guard said, "Hey, Mike, watch you all the time, come on in." And then I got back a little further and one of the nurses says, "Oh, you spoke at my school one time, come on back here." But then I got into the room and they realized this guy was serious, and boy, they got me out of there with no apologies. "You need to leave now. We've got work to do."
That happens.
Those 6 people in that room that day with my friend saved his life, changed his life, and those are success stories I know you love to hear about, but it's what your people do every single day. And so tell me what makes them so special in your mind.
In my mind, they're helping other people through probably the hardest day of their life.
Yep.
Not just the patient, but in many cases the family too. And it's the stressful time being in a hospital. Unless you're having a baby or plastic surgery, you didn't want to be there in the first place. And
Didn't plan on being there.
Yeah, I didn't plan on being there. So if they make your day go a little bit smoother and help you out in the pinch, then it's all worthwhile.
If you had known 2.5 years ago what you were facing with COVID and with restrictions and with testing and with vaccines and staffing, might you have gone, retirement in 2020 looked pretty good to me?
Well, Andy and I were talking about earlier, my plan was to retire when a little earlier. My dad retired when he was 60, so my intention was to retire a little earlier. It just didn't happen.
And
so
you could have.
I probably could have.
But
I still felt like I had something to give. And so that's what I wanted to do. So I don't know that I would have. Even if I had known that, I probably would have worked through it.
Well, I would not envy the new guy that came on board if you had retired 2 years ago and the first thing he faced was COVID without years of experience there. That must have served you well. Without bragging on yourself, do you think your years of experience paid off during those tough times?
I think it helped, but it was a lot of uncertainty. Most of what we were dealing with is, we've never dealt with this before. And, we go from 0 to 150 COVID patients within a matter of weeks. So I don't know that any experience would have helped there.
Same for your physicians. Those smart doctors you employ and pay a bunch of money to, they hadn't gone through it either. It was all new to them.
All new.
And hopefully we won't have to go through anything like that again.
Not.
It was a scary time. It continues to be a little bit edgy because the cases still pop up from time to time. Are you equipped to handle something like that again if you have to?
I think we are.
Yeah. You can't necessarily plan for it, but you have professionals trained to do what they do.
That's right.
Is there a consistent thing when you look for physicians or higher level staff, whether they be surgeons or regular family doctors or whatever, do you do the interviews, or are you part of a team that might?
We have a team that does.
What jumps out at you that makes you think, oh, this is a man or a woman that would fit in well with us?
You can always tell the people who communicate well and in the course of conversation. For example, when we go to dinner, how do they treat the waiter or the waitress? Are they demanding or are they engaging? Just this little simple thing. I can tell a whole lot in a dinner interview.
I'll bet you can. You've done enough interviews.
I've done quite a few of those.
And you don't just look for resume, long list of great facilities they've worked in. How they treat the waiter might be important. In fact, it is important, how they treat people around them.
Yeah.
Doctors are a little bit quirky sometimes. I've met some that you never know they're doctors who are just outgoing, but a lot of them are so smart. I don't know if quirky is fair, but you must deal with all kinds of personalities, all of them smarter than never would have gotten through medical school. So I'll bet you could almost write a book just about the personalities you've dealt
we're
with.
assuming that they got the degree and got through, that they're smart and they can handle it. Now, can you interact with the patients and can you help them? with their particular issue.
Can you make my patient, whether they're paying or came in the emergency room door, can you treat them the way they need to be
That's
treated?
right.
Because they're going to go out and tell other people how they were treated at DCH.
That's correct.
We're going to talk more in our final segment in a moment about some of the challenges you faced, change in leadership. We'll talk about that and some other things as we continue in a moment. I'm enjoying visiting with you. I hope you're enjoying this.
I am.
It's not bad.
No, it's not bad.
Take a break and come back. We're going to get a sip of water and continue in just a moment. And welcome back. We have a few more minutes left with Bryan Kindred. He's the President and Chief Executive Officer of the DCH Healthcare Authority. I'm enjoying our conversation. Thanks for joining us. Now, not too far down the road, end of July, you'll be stepping down and totally retiring. But you tell me you're going to stay available to the hospital.
In an advisory role for the transition, whatever that period is.
And that might be between you and your replacement, as
That's
long as he
correct.
might need to reach out to you. And even after you're gone, he can reach out to you. I'll bet he'll have your phone number. And
That's right.
can reach out to you, and you'll be more than happy to help. He probably won't ask for advice. Maybe he will. What advice would you tell him? You already said you would have, as a younger man, listened more. What advice would you give him?
I think the advice would be patient. Don't be too quick to pull the trigger. Her name is Katrina Kiefer. She's originally from Monroeville, Alabama, and I think she's going to do a great job.
Coming here from Augusta,
Augusta,
Georgia?
Georgia. She was the CEO there.
I read her bio resume. She sounds like an impressive person. We'll look forward to meeting her. Leave her a note, will you? Tell her
I will.
if Mike calls for an interview, go ahead
will.
and say yes.
And
then
do not worry. And
Then we have to get through Andy North.
That's right. You have to get through Andy.
That's the hard part.
That's right.
Let's talk about some challenges. I know
Sure.
you'd love to leave DCH right at the money line where you didn't make money, you're not supposed to make money, but not losing money either. But that ongoing challenge, and is the biggest financial strain on the hospital, people who come that you care for that cannot pay you in the emergency room. Is that still the biggest financial challenge?
That along with the staffing that you mentioned, we talked about earlier, just getting the right amount of staff. And so this charity care that we carry every year of $40 million is right at the top.
And that's substantial, and is there anything to do about that? Because people, if I had a baby that was sick and I didn't have coverage, you know where I'd be? Your emergency room. I'd bring them there tonight if I needed to, and you'd do the same thing if you had a
Sure,
sick
I
child.
would.
Can we do anything, though, to help them? Maybe an Obamacare insurance that's out there. Can we find ways to alleviate that so we're not bankrupting our hospital?
I think the potential for Medicaid expansion in our state, that's going to come back up, so you'll be seeing that in the future. I think working with the local organizations that help people who don't have health insurance, like Maud Watley Health Services.
Yeah.
And so those two things come to my mind. But the other thing I would think of is people who can pay, we don't need them running up the road or looking for it somewhere else. If they could stay locally, then all those things together will help.
And so the people who aren't able to pay now, you mentioned expansion of wealth Medicaid payments. I hear a lot of politicians around election time, we're against that, we're not going to do that. Is that because they think their base doesn't want to see their tax dollars go to health care for poor people and people who can't pay?
I'm not exactly sure, but I think it has to do with the Alabama funding is difficult, so they've got to have a funding source to pay for that. I think they understand it would help, but it's just a matter of coming up with the resources. So again, I think that's what they struggle with the most.
I won't really ask you a political question, but in the last few months, our legislature is trying to figure out how in the world are we going to spend this excess money we've got from COVID relief, and I want to go help health care for poor people.
The hospitals have been bearing the load for 2+ years. You could give some of that money back to us.
Do you tell your legislators that,
Yes,
and do
I
you lobby that even?
Yes, we do.
Yeah.
Yes, I do. Of course.
Because we're running our hospital at a deficit to the tune of $40 million. That could be solved fairly easily. The older I get, the more compassionate I am for people who can't afford to pay. I've got health insurance through the university.
Well, we certainly need it right now.
Yeah.
COVID, the last 2 years financially has really strapped us, and so it would help if they gave that money back to the hospitals.
I know you'd like
not all of it, but a lot of it.
a lot of it,
Yeah.
and that would go a long way in
Sure
helping.
would.
I know you get good reports from time to time, a good grade here and a bad grade there occasionally. You got some negative media attention about a recent leapfrog poll that gave you a grade of D for overall operation. First of all, is that fair? Do you look at it? I know you care, but do you just kind of take that as we're doing the best we can, and if there's legitimate complaints here, we'll work on them? What's your thoughts about that?
Disappointed in the score.
Yeah.
Want it to be better. We're going to work hard to turn that around. I don't know what else to say about it. I mean, we're graded along with all the other hospitals. We think we're better than that, but score is what it is, and so there are things we need to do better.
What's the main thing that seemed to bring a score down for you? What was the things that they concerned about?
Well, there's a 2-year lag in the scoring.
Oh.
So it's from 2 years ago. So there's some of those scores that take a while to turn around. A couple of things that we have done, particularly our electronic health record and how physicians interact with that. Well, our system prior to our upgrade, which was last year, would have been difficult for us to score properly. That's one thing that I would mention for sure.
So those things that score you down, you knew about long before the
we knew
score
about
came
that.
out.
Another one is we didn't have an intensivist program. These are physicians who are qualified to take care of patients in the intensive care unit. We didn't have that program until about 2 years ago. So those scores are just beginning to trickle in there. So we knew that. Those are some big things. Those took some additional dollars to do. I mean, for example, to upgrade our computer system, it was $35 million to do that. So it was not a small undertaking. And so we've been biting off those bigger things like that to improve the score, but it's also to help our patients too.
Of course, that's
Sure.
Everything you do is aimed towards that.
So we're disappointed. We want it to be better, and we're going to work hard to make it better.
And with the changes you've made, it probably will be better.
will.
Do they
It
do
will.
that every 2 years or so?
I
or
think the score comes out twice a year,
right.
and so
you'll be surprised if it's not better next time.
our prayer is it's going to be better. But we're going
Well,
to work hard at it.
Not just prayers, you've made some changes
Yeah, we
too
have.
to make it better. The computer upgrade reminds me of a press conference in front of your hospital when you guys got hacked at no fault of your own. Was all this upgrading part of that design to make sure that doesn't happen again? Because that was just an
that was already
unfortunate thing.
that was unfortunate. But that's happening to hospitals
Oh,
all across
everywhere.
the country.
I know.
I think that particular day, 14 other hospitals got hacked. And it's just as simple as opening up an attachment, and you shouldn't. You're getting a hurry, and boom, they open it, and then it's launched into your system. Thank goodness our information was not lost.
Right.
It was just encrypted.
It was held captive is what it was. Is
Yeah, it
that
was.
accurate?
That's right.
And that's in the rearview mirror too, and be much harder for them to do that, someone to do that to you now.
A little harder, yeah. Yeah.
And you hope it stays
I
harder.
hope it never happens again.
I know. Well, I hope you enjoy retirement. I appreciate this conversation with you. I hope you've enjoyed it too.
I have.
And you retire, but don't let Andy North go anywhere. We need him. Okay?
Got it.
All right. Thanks very much for
Thank you,
joining us,
Mike.
Mr. Kindred. I enjoyed our conversation. We appreciate you watching from time to time. Around holiday times, we'll replace our newscast with a program like this. Mr. Kindred and others who have joined us to talk about things in our area that are important. And I can't, off the top of my head, think of anything more important than the health care of all of us and everyone who lives in West Alabama. The folks at DCH, under fine leadership and the future fine leadership, are doing the best they can and hope to just keep getting better in the future. Thanks for watching our program today. I'm Mike Royer for everyone here. Thanks again, and have a great day, everybody.